Hello everyone, we are delighted to welcome you to this course on dual task training in Parkinson's disease, focusing on integrating movement, voice and cognition all into one type of exercise. My name is Josefa Domingos. I'm a physiotherapist by training, specializing in Parkinson's disease.
And I'm John Dean. I'm a speech-language pathologist and I also specialize in Parkinson's.
We are both very, I would say, passionate about this topic of dual task exercise. We believe in exercising differently. We believe by combining movement, voice, and cognition, people can better mimic daily life's challenges. We also believe that this makes the training more engaging for the patients, as well as for the exercise and health professionals.
Now, most professionals are already integrating dual task into their practice, but the lack of evidence is making professionals count on expertise to guide them on how to implement it better. Because we've been doing this for the past 15 years or so, we thought it might be useful if we shared some ideas we've gathered in that time.
So here is an example of a training session that is incorporating dual task exercises with 3 people with Parkinson, relatively young and high functioning, that are being challenged to keep walking while taking certain actions according to their quick interpretation of an auditory stimulus, in this case, random numbers. So if they hear a 5, they lift both their arms. If they hear an even number, they take a step forward. And if they hear an odd number, they take a step back. Then later on, we increase the complexity by making them compete running forward when they hear an even number. Now, importantly, I want you to notice how much fun the patients are having in this video. So why use it? How effective are these interventions? What are the risks? How successful is the implementation of the so-called novelty intervention? Is this implementation mainly based on professional expertise or current evidence? The truth is, despite the existing preliminary evidence in support for the benefits of such training, there are still no clinical guidelines on how to apply it. So healthcare professionals struggle to access practical examples and guidance about when to use it, how to apply it during a session, to whom to apply it to, for what different stages of people with Parkinson and the progression. And these are some of the questions that we will be approaching and reflecting upon today. So we have prepared several lectures for you around these questions, and this is a preview of our agenda. So we will have 10 lessons with several videos from our practice to exemplify what is being said. So starting with understanding what is dual task training and how has the evidence progressed in Parkinson. Then an overview of the clinical Parkinson deficits with a special focus on how the dual task interference presents itself in these daily life deficits. We will also take a quick look at what are the current treatment options for these Parkinson deficits. Then dive into the practicalities of dual task training with the how, when, where, and with whom we can apply it to. We will also focus on why and how we can add voice challenges as a secondary task. Then we will how to apply these in one-on-one training and also in group sessions. We will take a closer look on boxing as a popular example of dual task training. Then we will reflect on commonly used assessments for dual task training. And because of the current global shutdown, we have added a special chapter on feasibility of dual task training via telehealth. We hope that you enjoy this thought-provoking course as we unravel what it takes to guide the progress of dual task exercise and rehabilitation in Parkinson's disease.